Hey mamas, I am here with pelvic health physiotherapist Jessica Doig from Collingwood Pelvic Health to answer all of your postpartum exercise questions for both C-section and vaginal births. We're going to cover that big question of when can you start working out and how, as well as what to avoid, what is considered safe, and touch on those common scary terms we hear like diastasis recti, prolapse, the dreaded mummy tummy, and all the fun things.
I'm a pelvic floor physiotherapist based in Collingwood. So I actually just had a baby not too long ago via emergency C-section, which I'm sure we will dive into later. And he's almost a year old now. He'll be a year next year, which is traumatizing to me. Went by so quickly. I'm a pelvic floor physiotherapist. So essentially it is a orthopedic physiotherapist that specializes in the treatment of pelvic health conditions. So it's an advanced training, postgraduate training that focuses on women's health and men's health when it comes to things like urinary incontinence, pelvic organ prolapse, anything to do with prenatal and postpartum recovery, and yes, the big scary things like diastasis recti, any issues with your bowels or your bladder or anything below the belt, essentially.
So let's chat first about that reality of what a postpartum body looks and feels like. You and I have both experienced this, and there is so much I feel like I didn't know to expect. What did you think?
Yes, I think coming from the perspective of being postpartum myself, it's definitely an awakening. So especially with social media, there's this misconception and this sort of bounce back culture and perfectness that we see on our Instagram pages and on other social media platforms. And the reality is postpartum, you are, and if you're thinking like the immediate postpartum phase, like when baby has just arrived, your body goes through a significant amount of change very, very quickly. It took you 9 months for your body to expand and soften and grow. And then we expect that growth to be completely eliminated days after baby is here, which is just not realistic. Realistically, your belly is going to be soft, your body is going to be soft and squishy, your uterus is going to be shrinking down back to the normal size. Your uterus goes from like the size of a pear, right, to the size of a watermelon, right? And so it takes weeks for that organ to kind of go back to normal. And so of course your body is also going to take that long, if not longer, to kind of shrink back down. But yes, there's this misconception that something is wrong with you if your body is soft, especially your belly region after having a baby, and that is 100% normal. And even if you're looking for diastasis recti, or you're looking for those issues, you really shouldn't be looking until at least 6 weeks postpartum, because that's how long it takes for your tissue and your fascia to kind of return to baseline, if not longer than that.
I'm sure you get asked this all the time, but like so many moms want to know, when can they start working out then?
So I think it depends on the definition of exercise or working out, and it depends on your baseline. So if you're thinking exercise is the form of like regulated or structured exertion, then I would say try to wait until that 6-week mark before you're doing anything high intensity. So 6 weeks is the sort of baseline timeline for allowing tissues to recover, right? So childbirth is very traumatic, regardless of whether or not it was a vaginal delivery or a cesarean. With a vaginal delivery, like you have trauma to your pelvic floor. If you think about the size of your infant or your baby going through the structures of your pelvic floor, there is injury that occurs, regardless of how your birth went. There is some degree of injury, and sometimes more injury in others than not. So it'll depend on sort of how your birth experiences was, how quickly you could get back into exercise. But general guidelines actually are kind of not great. So there's this lovely like 1 week one visit 6 weeks postpartum where you go in and you get a verbal. So they're not even generally doing internal exams or checking you physically.
Which just blew my mind, by the way. Like I was like, do you want to see anything? He's like, nope, we're good.
Yeah. So considering that like childbirth is so traumatic to the female body, it is pretty mind-boggling that they don't have a standard like physical assessment after, right? They just sort of ask you if you're having any problems. And if you say no, great, do whatever you want. So there's this sort of do nothing for 6 weeks and then do anything you want at 6 weeks, which doesn't make logical sense, right? And especially when you think about cesarean surgeries, it's the #1 surgery in Canada, right? It's a major abdominal surgery. They cut through multiple layers of tissue. So it's mind-boggling that there's not a standard protocol. The #1 surgeries after C-section are things like hip and knee replacements, where we know they have like months-long coverage from the government for physiotherapy rehab. And the stay in hospital, the recovery is actually quite similar, except those people aren't taking care of tiny humans when they get home, right? And expected to, if they even have other tiny humans to look after, right? So it's crazy to me. We could talk about that forever. But when it comes specifically to exercise, there should be a graded return. So you should start out with basic core activation exercises, like get back in touch with your pelvic floor and your abdominal wall, and then progress into more basic functional movements like squats and lunges and lifting, right? All the things that you're already doing at home when it comes to like lifting the car seat, lifting the strollers, lifting the baby, and all of the stuff that comes with those tiny humans. It's heavy, right? So you can't go from completely horizontal nothing to CrossFit. Like you just can't, your body won't respond well to it. So yes, I always recommend that at 6 weeks, you go to a pelvic physio and have an internal examination, have them look at your core, your pelvic floor and how they're functioning together, and then set you up with a progressive program to get back into the things you like to do. So signs that would be like, that you can look out for, because I find at around 4 weeks postpartum, everyone has the itch to do something, regardless of how your birth went. It's like 4 weeks.
Yeah.
I feel fine. I want to do all the things. And it might not be fine. You might not actually feel that good. It's just you feel better than what you did at day like 4 postpartum. And you just forget what it feels like to feel normal. But you want to do more things. And that's totally fine. You can start doing your core activation. You can start some walking and things like that, and then look out for signs that you're doing too much. Like if you're having leakage or pain or pressure or bleeding, or even pains like back pain, hip pain, knee pain, those are all signs that you're probably just going a little bit too quick. But yes, 4 weeks is a sweet spot where like the tissues themselves aren't fully recovered yet, but you feel okay. So there is this sort of like vulnerability there where you're going back into exercise and your risk of injury is a little bit higher because you feel externally okay. But you maybe haven't given the pelvic floor tissues and your abdominal wall enough time to fully recover. And that's when you would see a little bit more injury, I would say.
Oh, that's really good to know.
Mm-hmm.
And then what is some of that? So you talked about like pelvic core activation, pelvic core, is that right?
Pelvic floor and core activation?
Yes, you talk about the pelvic floor and core activation that you can start early on. And what do those exercises look like? Because I'm sure you're not saying like, let's go jump into planks and like bicycles. So what are we doing there?
Yeah, so I think that is also individualized. So in an ideal world, you would have seen a pelvic physio during pregnancy, right? But that's not actually attainable for a lot of people, depending on their finances or where they live. So I would say basic pelvic floor activation, so the traditional Kegel exercise, is one that you could do, but we want to make sure that you know how to fully contract and relax your pelvic floor. So if you're experiencing pain, leakage, pressure, go see a pelvic physio and make sure you have exercises that are targeted towards you. But generally speaking, if you've had a vaginal delivery, doing some light pelvic floor strengthening is actually going to be beneficial, because you've had such amount of stretch and length go through your pelvic floor structures. Likely they are weakened, right? In that sort of postpartum period. So Most people think of your pelvic floor like one muscle that just sort of squeezes and relaxes to hold urine in. It's actually a big network of muscles that sort of expand from your pubic bone to your hips and they back into your tailbone. So I like to think of it kind of like a little trampoline of muscles at the bottom of your pelvis. And you need to have some give in that trampoline to be able to absorb pressure. And you also need to have some spring back in order to propel up, right? And to protect your pelvic organs and your urinary system. And so if there's a dysfunction in the pelvic floor, that's when we see things like leakage and pain and pressures. And so gently learning how to contract and relax those postpartum can be really beneficial. The key is to make sure that you know how to do them before you do them, right? So if you can learn how to contract and relax your pelvic floor during pregnancy before there's a trauma, it's a lot easier to sort of connect with that in the postpartum period. It's not that you can't do it postpartum, but having someone actually do an internal exam and teach you can be really beneficial. A lot of the research has shown that just verbally telling someone how to Kegel isn't actually that effective. You actually need that feedback of the internal exam. That would be like the gold standard. Yeah. And then core activation, we talk about your deeper core system as being your breathing muscle, your diaphragm, your transverse abdominis, which is that deeper layer of abdominal wall underneath the six pack, underneath the obliques, and then your pelvic floor. So it's kind of like this canister, when we say core, canister of that keeps your pressure system intact. So your breathing muscle, your pelvic floor, and then your transverse abdominis. And unfortunately, pregnancy, right, puts stress on that core system. And so learning how to activate it prenatally can also be beneficial for you to start doing that in that 0 to 6 week time frame to start getting things active again.
And I think there's such a misconception too that people have about like, if you, like, I mean, those six pack abs that you might see visually doesn't always mean that the internal core system is doing the right things or working effectively or feeling good. Like you could have great abs and back pain and not have that proper support system, right? Like you really need to start with the inside out, I guess, in a sense, and healing those internal functions first.
Yeah, 100%. Yes. And I can't tell you how many times, especially with social media, right? Like, oh, that person looks like they've recovered fine. It looks like they bounced back perfectly. They're so thin. I can see their abs. They're out running 10 miles at like 4 weeks, but you don't actually know what that person is going through. That person might have leakage. They might have pelvic pressure or prolapse, and all of those things. So it's never that easy. But when it comes to, like, you're right. When we think about core, most people think six pack. And that's when we're talking about things like diastasis, your rectus abdominis, that lovely six pack muscle that goes sternum to pubic bone that everybody wants to see. We're talking deeper than that. So when it comes to abdominal separation, which is the term diastasis recti or rectus diastasis abdominis, we're talking about that six pack muscle, right? So there's a connective tissue that holds the left and the right side together, and it gets sort of stretched during pregnancy, right? Yes. It lengthens to allow your belly to get bigger. It doesn't split open like a zipper. It's just that it's thinning. So that thinned tissue is 100% necessary during pregnancy for your body to expand and grow. And then in about 40 to 50% of women postnatally, it doesn't completely come back together on its own. So we're left with a little bit of that overstretched soft tissue. And so after 6 weeks postpartum, when you're looking to see if you might have an abdominal separation, one of the signs would be sort of, you referred to it as like the mummy tummy, which I don't love those words, mostly because it implies negative things about moms' bellies. But you're right, like the mom pooch, the mommy tummy, like people, the reason why it's called that is because moms notice that there's this extra doming or softness in their bellies, and it's very localized. To this sort of one area. And sometimes that can be because that overstretched, thinned tissue is sort of pushing outwards. So your abdominal wall or your abdominal contents, right? They're not, your torso isn't empty. So you've got your bowels, your stomach, your and like everything is in there. And so when there's a laxity in that front wall, right, it starts to pooch outwards. So if you'll notice with the diastasis that you might notice bloating more excessively than you ever have, or if you eat a big breakfast, like you can tell significantly more than you maybe had in the past. Or you might notice your things like back pain, hip pain, pelvic pain, because you don't have the same pressure control system, right? There's a little bit of a weakness in one of your core muscles, and it starts to show in those different ways. The most obvious sign is that sort of separation or that pooching when you lift your head up. So your six-pack muscle essentially like bends you in half. It lets you crunch. And so if you were to do a crunch and you notice that your tummy was sort of pooching forward, kind of like a cone or a doming, I call it like a Toblerone. So you have like this little like Tobleroning thing happening midline. Then that would be a sign that you have a bit of a separation.
Okay.
If you're not sure, it's always a good idea to kind of get it checked. But if you're noticing if you're noticing that you're working out and you're not feeling your core engaging, especially the lower abdominals, it tends to be that area between your pubic bone and your belly button, that little area there, like you'll find that you're having a harder time activating that or feeling like that's working. That's a good sign that you should see a physio because there's likely something going on with your core.
But if you want to do a self-assessment, you can, right? To a degree. And what would that?
Yeah, absolutely. So just lie down on your back with your knees bent. And you're looking, if you remember that line that you got when you're pregnant, you might still have it postpartum. It's called your linea nigra. Yeah, it's this line. That's the area that you're looking for, right? Because that's the soft tissue or the fascia that gets lengthened. So you lay on your back and you point your fingertips towards your pubic bone and you start about 3 fingers above your navel. And you're going to let your hands sort of sink in to the abdominal wall as much as you can. And the key here is to keep your head down while you're assessing. There's a lot of there's a lot of demonstration because you want to look, right? You're like looking, but if you lift your head up before you actually have your hand in your abdomen, the pressure from you lifting your head up will just push your hand out. So you'll get a false negative. And a lot of fitness professionals demonstrations on Instagram have them with their head up, and it drives me insane. Keep your head down until you have your pressure and you've sort of got your base resistance, and then lift your head up and check for the separation. And if you do have a separation, you'll either feel that you can wiggle your hands 1 or 2, 3, 4 more fingers in between the 2 sides of your six-pack muscle. And then you would check at your navel, and then you would check down towards your pubic bone. Because remember that six-pack goes all the way from your sternum, bottom of your rib cage, to your pubic symphysis or to your pubic bone. So you want to make sure you're checking all the way along that tissue. It is tricky to do on yourself because you want to see it, right? You want to look, you want to see, and people get a little bit too anxious about what they're doing. So make sure you have a trained professional assess you if you're not sure. But if you think you might have one, then you can absolutely do like the core rehabilitation. I honestly think even if you don't have a separation, you should strengthen your core postnatally, right? If you think about what has gone on during pregnancy, like just by like visual observation, there's a weakening that happens to your abdominal wall, right? Like we know this. And so postnatally, regaining control and strengthening those muscles is key for lifetime mobility.
And it's so true. I can only speak on my own personal experience, but I actually find that having gone through, now 2 pregnancies, especially after my first pregnancy, like I had a lot of pain. Like a lot of pain comes back in pregnancy, that like maybe old sports injuries, I had old dance injuries, bad hips, low back pains that came back, that I actually was able to fully heal after pregnancy, where I feel like I'm activating my core and using my core strength more than I ever had before. And so I feel like eliminated back pain almost completely out of my life, which is mind blowing because I struggle with back pain from like teenage years through to my 20s, right? It really is kind of like quality of life changing in a sense, like to not have to, like to learn that certain pain isn't normal. Pain is never normal. It doesn't have to be normal. We can do things to fix it.
I'm definitely one of those people that thinks we should be talking about pelvic floors in high school classrooms and like
Where was that in
educating
health class,
females
right?
about it for sure. And
Yeah.
I also see a lot of athletic females in that sort of postpartum period that actually have like the concept of being able to activate their transverse abdominis or their deep core system is very foreign. They're very good at activating different muscles to sort of compensate because they don't have that deeper connection to their lower abdominal for whatever reason, right? So yes, I think teaching young girls and young boys how to activate their core well, and giving them the actual anatomy, right? I don't know why we're so afraid of anatomy. Giving them anatomy behind it, right?
Yes.
This is normal, would change a lot of things, right? It would change a lot of outcomes for women, especially.
Some of when mom's starting to feel better, maybe seen pelvic health physio a few times, running is so tempting. I don't know what it is. I'm not a runner and I wanted to run after having a baby. It felt like it was either alone time or I could throw baby in the stroller and go for a nice little jog. It's easy, it's convenient, it's right there. I just have to walk out my door. Is running safe? When is running safe? And how should we be running? Like, what should that look like if we're going to choose that activity?
Yeah. Running is universally like a mom activity, right? Like I think majority of runners are female and majority of them are childbearing age. So there's going to be a ton of postpartum runners. And I myself is also one of those people that just wanted to throw my shoes on and go for a run because it seems attainable, right? You don't have to think about it. You don't have to program a workout. You just tie your shoes on, like put your shoes on and head out. And if you want to put the baby in the stroller and go with, like, it's just so, it's a little bit more attainable for women and for moms. The problem is running is a very physically demanding sport. So there is a lot of impact and strength that is required for running. It's an endurance sport, depending on how you're doing it. When you run, you essentially land on one leg, right? So when you're running, you land on one leg. So 4 to 6 times your body weight goes through that one leg every time it hits the ground. So you need to have proper hip stability to absorb the weight from the ground and to propel you forward as well. So your pelvic floor actually has to work quite hard and respond really quickly when you are running. So it's one of those higher intensity sports, actually, one of the hardest things you could do postpartum. And yet it's one of the easiest ones to accomplish. So it's very difficult. So if the other thing is, if you weren't a runner before, right, we know that the people who are at highest risk of attaining any type of injury with running are the novice ones, the ones who didn't run previously. So if you throw in diastasis recti and a weak pelvic floor and all of the things, and then at 4 weeks they're out running, you're in that sweet spot for injury is what I like to say. Your body can't tolerate as much. There is a good way to get back to running. And that might look different. So if you ran throughout your pregnancy, right, that might look quite different than if you took 9 months away from running and now we want to run all of a sudden again, right? You're not going to be able to run those 10Ks right away. You really need to build up to it. So some things that you want to do before running, right, would be basic strength training, right? Like, can you do a squat? Can you do a lunge? Can you do step ups, things like that without pain and with good control of your pelvic floor and your core? Can you hop? Can you jump? Because you're landing, right? You need to be able to absorb force from the ground. Can you do all those things without pressure, pain, leakage, or signs of intolerance, right? So these signs that your body isn't responding well to that activity would be things like pain in my pubic area, pain anywhere, really, pressure, leakage. It might just not feel like, if you feel like you have to pee immediately every time you jump, it's probably not a good time to start running. There was actually a new set of guidelines released, I think it was in 2019 or 2020, that say that they actually recommend that you wait even longer, like around 12 weeks to start getting back into running, as opposed to that 6-week cutoff, just because it takes that long for your body to be able to absorb that type of impact. Everybody's different. I've had women come into my office and we do all the standard testing and then they can go back at, let's say, 8 weeks or whatever slowly. But I always tell women, you are probably not the exception. you're probably not, right?
Fair,
There are some
fair.
exceptions to the rule. It's probably not you. So you should probably scale back. It's always, always, always better to be conservative when you're coming back from postpartum, and give yourself grace. So there's other things that affect your ability to exercise, right? You versus, like me versus Chelsea, let's say postnatally, she also has a toddler at home, right? One of us was breastfeeding, one of us wasn't. One of us slept better and the other one didn't, right? So there's sleep challenges, there's breastfeeding challenges, there's hormonal fluctuations, all of the things, regardless of if you had a vaginal delivery or if you have a C-section delivery, all of those things play into like your ability to handle more stress, right? Your tissues and the resiliency of your body depends not only on how much exercise, but what kind of sleep you're getting, what kind of nutrition you're getting, what are your genetics, what is your stress, what's your anxiety, what's your support like at home. So all of those things play a big role into how much exercise you can tolerate and when you can do it and what type of exercise is good for you. So I think bigger picture, people need to start talking about that. If you have extreme anxiety and there's a global pandemic and you have your whole, like you're schooling your children from home and you have a newborn that's not breastfeeding or sleeping well, like, of course you're not going to be out running. Like, that's not going to feel good, right? Maybe 10 minutes of like yoga and relaxation would be great, right? So I think you have to adjust your expectations based on those things. And I don't think there's enough of that in social media. And I just think it's crazy.
No, I couldn't agree with you more. It's so true. We put so much pressure on ourselves to just, we want to be the exception. We do. And
and even like even if you're not comparing to yourself to others, it's comparing yourself to before you were pregnant, right? Like before I had children, I went to the gym 6 days a week for 2 hours. It's like crazy stuff, right? Now my workouts are 30 to 40 minutes and they're basically I don't even care about performance, right? So your expectations and your goals will adjust to your lifestyle and what's important to you, right? So if it's very important for you to be in that CrossFit class, perfect. We can get you in that CrossFit class with modifications likely and build yourself back up to it, right? And if that's great, that's great. If it's just to do Pilates at home for 30 minutes by yourself, right? Like lock a door and do it and without anybody interrupting you, that's also great. So your goals will be different. So your exercise progression should be different.
That makes so much sense. And I do find like I had to remind a lot of my my new mom friends, like who kind of saw me after my oldest is now 6, right? And they saw me a few years after her and they were like, well, you're doing so much now. And it's like, yeah, but it literally did take me 3 years to get here. Like it took me 3 full years to really get back to myself in terms of my fitness goals again. And that's okay because it's 3 years, but then it's like forever, right? Like, and then you're good to go. It's not that state of postpartum it is forever in a sense, but it's not forever, if you know what I mean, right? Like that immediate state of just feeling not quite yourself. It's not forever. You'll get
it's just I like to call it like a season, right?
Yeah.
Like this is a season of life. Temporary, it's very temporary and fleeting, right? They're only that little for that long. And especially if you're a new mom, you have this like the mom guilt adjustments, right? Like you feel guilty about leaving them or the time you're away from them, enough to exercise. Like there's all of these things, all of these worries, right? All of the things you have to worry about as a mom, like, and all the like tasks that you now have that are your responsibility on top of whether or not you're working or not, like all of these things. And so once your children get a bit more independent and need you a little bit less, you might have more space for yourself.
Totally. True.
That's not to say I don't think you should prioritize yourself and your health. You definitely should. But just don't be the person that's putting too much expectations out there, right? Give yourself some grace. I think that if we had more examples of what it actually looks like postpartum, what the majority of women are doing versus like Karen from Beachbody trying to sell you her programming, right? Like, we don't need any more Karens, right? We need more of the people that are showing you what it actually is like, right? If it's not realistic for you to do 60 minutes of exercise every day, then don't. You don't need to do a certain type or a certain style or a certain length of exercise to be fit and to be healthy. You just don't. It just has to fit your lifestyle and leave you feeling strong and confident and pain-free and without peeing your pants.
I love that. And you do not, peeing your pants is never normal. Just putting that out there. So, okay, you talk about Karen from Beachbody. Let's talk a little bit more about Karen from Beachbody. Let's talk about what we're seeing on social media. Like, how do you weed through? The second you have a baby, your algorithms know, and they're like, hey, you want to lose that weight? Here you go. Here's this, here's that, here's this person. Like, it's crazy, my Instagram feed, how it changed. How do you weed through that and find the good quality information? Because I mean, any women, any mom, anybody can say, hey, I had success with this. I've decided now to rebrand myself to be all about my success and sharing that with other women. And here you go. Here's my advice of what worked for me, without, them necessarily having the educational backing to say, this will work for you. Just because it worked for one person doesn't mean it's going to work for everybody. So how do you find the good quality advice? What are you looking for?
Yeah, this is tricky. And like Beachbody, please don't sue me. I think you have a great program. It was just a random example. So,
I got you though.
Yeah. So, but what I mean by that was that you're right. Like, there are really well-intentioned women who have a baby and then they get back into fitness and they have this new passion for how either difficult it was, or they want to help other women to do the same thing, which is very admirable. And we need more of you, but we need you to have the credentials and the education behind it before you start training other women, because not every woman is like you, right? You maybe don't have the background or the knowledge to know what to do or how to modify things or what to look for. What are the contraindications? How to change your programming based on what that person is doing in front of you versus just your general experience. And that's where I think it can get very confusing for people, especially with all of these like self-proclaimed core and pelvic floor experts, which I'm not going to go on a rant about, because I could rant for a very long time. And it's not to offend anybody. It's just, my mom could make a core and pelvic floor certification program and sell it to people. And she is like an accountant. She does nothing to do. She has no fitness knowledge. Sorry, mom. Nothing, right? So personal training is an unregulated profession. There's nobody out there standardizing how that they can advertise themselves, what kind of education they need. And so there's nothing out there. So someone who says on Instagram that they're a core and pelvic floor expert is mind-boggling to me. If you can't assess the pelvic floor, then how could you possibly be an expert in it? But also, ask these people on Instagram where they got their certifications from. What are your certifications? What are your credentials? What is your background? And if they get offended, it's because they don't have any, right? Or they don't have the right ones. Because if you ask somebody, if you asked me what my education was, I would have no problem telling you what it was, right? And how that's good for you. If you ask somebody who doesn't have really the greatest credentials, they say, oh, I went and I got this certification. You can say, how many hours did it take you? Is it a weekend course, or do you have a master's in exercise science, right? Those are two very different things that they're not telling you on the Instagram bio, right? It just says, I'm an expert in postpartum, blah, blah, blah. I'm an expert in pelvic floor, right? But what does that mean? It could mean nothing. It could mean that they just decided that they had a baby and now they're an expert, right? If you trust, like they had a baby, but they're not walking around catching babies, so they shouldn't be walking around training women. I just think there's a very big disconnect there. And I'm trying not to use the F word a lot right now because I'm so passionate about the fact that women are so vulnerable. They have a lot of insecurities postnatally. We're sleep deprived, and we want to do everything we possibly can. And I just think it's very profitable for some women or for some people to prey on that. And I want you to make sure that you're getting good, reputable programming if you are going to, spend your money on something. So ask them what their credentials are, how long it took them, what did they do besides that? Like, what was their pre-profession, right? Like, know all of these things, and then make an informed decision about whether or not you want to give them your money and your time.
I think that's a great approach. And I am so thankful that you have taken the time to become an expert in this and to put yourself out there online, especially on Instagram. If you haven't looked her up, she has her Collingwood Pelvic. It's Collingwood Pelvic Health, right? Your business.
Yep.
And then she's got her, the Athletic Pelvis. I'll put all the handles down below in the description so you can find her. She puts out awesome videos on just exercises, what to look for, how to progress. You can literally follow Jess's postpartum journey on her Athletic Pelvis account.
If you are looking for something specific in your area, if you want to find a reputable pelvic physio, or if you want to ask me about what I think about certain programs, I'd be happy to do that or have that discussion with you. Just send me a message. I usually hang out on Instagram. It's pretty easy to get a hold of me. So just send me a DM. I'm happy to have those conversations. If you had a great experience, if you had a poor experience, if you're just looking for someone to be referred to, just shoot me a message. I'd be happy to help you.
That is so awesome. Thank you so much. Yes, thank you so much. Our moms at the Mabelhood totally appreciate it. And thank you for your time.
Oh, it was fun. You're welcome.
All right. See you later. Bye.